Hello, hello, hello. Welcome to my dray. I'm really glad you stopped by. I really hope you'll stay. Okay, so content warning. In my last video, I mentioned that I was going to do a video about chemotherapy and some of the side effects and some of the things that I do to help get through them. So that's what this video is about. If this is something you're not interested in, I'm glad you stopped by. My hope in, oops, sorry sweetie, just don't hit my cat with the empty box, which she'll now jump into. This is all just, well, you can't see it, but these are all just things that since I started chemo a couple of months ago, I've had some side effects, and let me sort of, is that better? No. Is that better? Meh. Doesn't really matter. Some of the things that have helped me get through it. You might know somebody that's going to have to go through chemo or is going through, or you might be, or whatever. First things to say is there are so many different types of chemo medications, combinations of those medications, strengths of those medications when they're given to you. Nobody has exactly the same side effects, reactions, and journey as the person sitting in the chair right beside them. I have a friend who is going through chemo and having a very difficult time. Mine is not going too badly. I'm really blessed in that I'm actually, I've got one more treatment left. Just had my 5th one last week. So today's a bit of a rough day because well, I'll get into the thing, but it's a day, you know, it's going to be there. It's a day. So I have a new blanket over my chair. It's cozy. And blankets are one of the things that you might want to think about taking. I have this. This is one thing that goes with me every treatment. My Weird Girls boredom bag. Got this on Temu for like $5 or $6. Really cute. But I've got a book in it. I've got a lunch bag in it. I've got my wallet in it. That's not smart. Put the wallet in the purse. Crossword puzzle, sewing kit, stuff to do. I take that with me every time. I rarely use it other than the lunchbox. Excuse me. But, you know, I'm in for, some people are only in for like half an hour. I'm in for 7 hours. 6 hours treatment, 1 hour prep. Pardon me. But yeah, so these are the things that my first treatment was horrific. They judged the dose on my body size and age and all the things that they do, but I had a reaction to one of the drugs, and that was not, nobody could have seen that coming. I was out for like 7 or 8 minutes. I thought I was only out for a few seconds, but yeah, I had severe difficulty breathing. When I woke up, I was on oxygen, and then it was all kinds of fun stuff. And the side effects after that treatment, after that, they adjusted right away, and it was fine. But the side effects after that were horrific. I never threw up, but I felt like it constantly. I could not walk for a couple of days. Always seems to start on about the 3rd day after treatment. They call it chemo legs, and I could not walk. I was bedbound for about 3 days. Fortunately, they adjusted the medication the next treatment, and it was much easier. Only bedbound for 1 day. I did have help from my lovely neighbor who looked after our friend down the hall. I couldn't walk down to the end of the hall. But again, they adjusted it a little bit more for the 3rd one, and I still get the leg pain. I'm in the middle of it today, but I'm walking, and there's really nothing that can help that except for prescription pain pills, which you would obviously, or your friend or whoever would obviously talk to their doctor about. So that's the medical big stuff side. Some common side effects, very common side effects, are mouth sores. And I'm going through that too today. Things that I have found that really, really helped. This. It is, if I'm not mistaken, it was like $15 or $16. It's Oral-B mouth sore oral rinse. For canker sores, cheek bites, braces, denture irritations. It helps a lot. I get just little sores in my cheeks, on my lips. Well, I got other stuff for my lips, but my tongue. And it only lasts a day or two. But this really, really helps. So it's Oral-B mouth sore. If you end up ever need to know, this stuff works. Whoops, lost the lid. Don't want to lose, not the lid, the cap. Because you only use a tiny little bit. Yeah, it's expensive, but it's not expensive. It's $15, but 15 or 16 bucks. But it's going to last a long time. Also for the mouth, which I know I have it. Oh, right here it is. My lips get really sore, and I've got this stuff. And again, it was $10 for this teeny tiny little tube. Lysine lip clear. It's called Quantum Health Lip Clear Lysine Cold Sore Treatment. I got it at Walmart. It was, like I said, 10 bucks. You use the tiniest bit. Like, I'm going to show you. If you can barely even see it. Just that teeny tiny little bit. And I mean, it's not immediately healing, but it's soothing, and it does heal faster. So that is a necessity if you end up having mouth sores. I keep that beside my bed because I can manage through the day, but at nighttime it gets really, really sore. So along the lines of mouth is, oh, I didn't bring in the other bottle, but that's okay. Biotine Dry Mouth Spray. And I've forgotten how much this was. Again, it was like 10 bucks. It wasn't, none of this stuff is cheap. That's the only problem. But it is refreshing, and it soothes your mouth, because I get dry mouth. And that's another fairly common side effect. So that I keep in my purse, along with Allie's Choice hand sanitizer, so pure. I can't remember where I got this. It may have been Walmart. Rose water. Just, you want to always make sure that you're protected, because chemo does lower your immunity. So colds and things, like I've been dealing with a cold for almost a month now, and you can still tell it's a little raspy. But you really got to be careful about. Okay, those go in my purse, because I keep them with me because I use them frequently. Yeah, they really, really help. The biotin, the spray, also comes in a rinse, which is great. I don't use it as much because I've got the spray. You can refill the spray bottle from the big bottle anyway, so I'm good. Good and golden. Dry mouth. Electrolytes. Those are, I've forgotten the brand. My friend gave me a bunch of them, but they're the little pouches, tube pouches. Every time I get one out, my cat thinks it's a squeezy treat. But yeah, it's just a little pouch of electrolytes, and it just helps. Okay, one of the other side effects is dry skin, oily skin, itchy skin, sore skin. Mostly on my, I'm going to take this off because this is what it's all about. This happens, right? Every now and then I'll find a long, well, you can't see it, but a long hair and go, holy crap, because I've been hairless now for 6 weeks, something more than that, I don't know. Anyway, my head's always cold at night because I sleep in front of a fan. So I said, I think perhaps in an earlier video I may have shown you this, but I'm going to anyway because this is pertinent to this video. This is how I sleep at night. Oops, we came undone. We've come undone. Ready for a giggle? Warm head, no light. With that and I know I brought them out. You can't come up yet, Opal. Oh, here. Breathe Right nose strips. I put one of these on and it just opens up your nostrils and a little bit more air comes in. I don't have difficulty breathing at night, but it just, it might be psychosomatic, it might be, I don't know, but this opens up my nose. And since I started, I'm going to continue using these always because I just sleep so much better. And they are, again, they're not cheap. I've got some on Temu that are pretty good. I showed them in either the last video or the one before. They're not bad at all, but they aren't quite as good as forking out the extra couple of bucks for the good ones. It's all up to you, right? Dry scalp. Hey, what are you doing? Let's throw things around. She never knocks stuff off. I'm going to move this because that'll make some room for her. Dry skin, Lubriderm. $18. Walmart. This is dermatologist developed, advanced moisture therapy, itchy extra dry skin, fragrance free, clean, non-greasy feeling. It's vitamin E, provitamin B5, 48 words, mouth, 48-hour clinically proven moisturization. It helps a lot. Near the end of my cycle, the chemo cycle, I go every 3 weeks. I get insane itches, mostly my legs below the knees. And this is remarkable. And again, you don't use much, so yeah, it's expensive, but it's going to last for ages. And I mean, you don't just need it for the itchies, it's beautifully moisturizing. Really, really nice. My friend got me this one, and it's beautiful too. So I don't know how much this is. I'm pretty sure you can get it at Walmart at St. Ives. Soothing oatmeal and shea butter body lotion, and this is wonderful. I love this stuff. It smells nice, and it feels nice, and I usually just use it after a shower. But speaking of showers, I don't shower I didn't shower every day because I had the PICC line. And it's just a pain in the nose to shower with a PICC line. But that got removed on Wednesday. Body said, get lost, and it did. So they had to take it out. But I've always, I have an oily scalp. So I would wash it, a couple times a day. I'll use a baby wipe and just wipe. Or use one of these things. These are amazing. They're Dollarama, $4.50 for 60 of them. And it's just makeup cleansing wipes. Cucumber extract. But it's so cooling and refreshing. I just, all over, and then my head, and I feel great. So those are, either for any time, anyone, to keep a pack of them around in the summertime when it's all hot. You just wipe down and feel great. On days when I don't shower, I got this little and again, I can't remember what I paid for it. I'm pretty sure I got it at Walmart. Cetaphil Gentle Skin Cleanser. And just the tiniest, like a fingertip full. And wash my head with a washcloth over the sink. Just feels nice. And it's all about comfort. I'm telling you, it's all about comfort. Um, for proper shampoo, my kid Nick noticed this and said, pointed it out to me. It's Dove Derma Scalp Dandruff Relief, which, you know, is always something to take care of. It's salicylic acid, 2%. It was $16 for 473 ml bottle. Again, well, especially me, I only use a very tiny bit, but it's soothing and feels good after. This is nice, and it's starting to grow back, so I've got little fuzz. It's starting to, I just said that, it's starting to grow back. But that helps a lot. It just doesn't irritate my scalp, which I find I have a lot of, it can get really sore at times. These are all typical side effects of my chemotherapy treatments. Again, when the itches get, especially the first time around when everything was so exaggerated, I was itching to where it was raw, and I got Bactine. And I got this quite a while ago, so I probably got it from Walmart. And #1 antiseptic spray in Canada. It's just a first aid spray, but it really helps with the itch. And when I'm not going to show you because it's a little gross, they put a bandage over the PICC line, and when I took it off, it started to stick, and I thought, oh, well, it's like a regular bandage. You rip it off, right? No, don't do that. Don't do that, because it tore off skin. And it was sore, but a couple of spritzes of that, and I wrapped it up in some gauze, and it was fine by next day. Yeah, I know. Opal's mad at me because she used to think that the PICC line was a toy, because the one little piece that would stick out and flop around she thought was fun to play with. Again, I'm sort of hopping around a little bit here, but back to protecting yourself from germs and stuff that is around. You don't want to get sick. And chemotherapy, the medications, leave your body, and like I've said, mostly through bathroom stuff, all the stuff that you do, and then sometimes vomiting, coughing, sneezing, tears, mucus, to some degree perspiration. So I do not take chances with anybody that I care about, my kitty cats, my friends, my neighbors, strangers on the street that I might bump into. Temu. It always turns into a Temu haul, right? Temu. 50 pairs, 100 gloves, and they were like $4, and they're pink. These were large, they're pink, they're cute. I also got some paper masks that I couldn't find offhand to show you, but they're pretty. They just have little daisies on them. They're paper, and they have just proper paper masks, but they have little daisies printed on them. They're cute. And then these, and I got these, I don't know where I got these, but they're just your regular, you pick them up in the hospital, except I don't like to pick the ones up in the hospital because people grab from like below so that they don't have to touch the top one, so that there's a whole little layer of ones that people have been grabbing, so I just take my own. Better safe than sorry. They're ugly, so I cover them with this. And if I'm just going out for a walk, I'll just put one of these on. Again, Temu, like maybe $3, not even, they've got the cutest little masks. These are not good for like full protection. They're good for covering up the paper ones. See, she looks like you. But yeah, and Temu is also really good for these caps. This is actually like a nursing cap, surgical cap or whatever. It's cotton. It'll feel much nicer in the summertime than like the polyester ones. they're nice, they're soft, and they're really comfortable, but come summertime, they might be a little too hot. But this is cotton, and they got a lot of different patterns and styles. This, I think, was $5 or $6. It was a little more expensive than some of them, but it's cute, and I would wear it. You know, I got no problem wearing it. I like it. Also from Temu. Temu has a lot, actually I was really surprised. Temu has a lot of medical things that will help with, you can just type in chemo supplies, and it comes up with some, you know, like the masks, the pill bottles, all kinds of stuff. I got this, now I got this from Dollarama, $2, for my everyday that I've been taking for years medications. I have to fill that tonight. I got this absolutely gorgeous, it's a cosmetics bag, but it's for the extra little things that you don't use every day. It's got my Tylenol in it, or my Advil, my Tylenol, Imodium, Gravol, eczema cream for the itches. That's the, you know, just little things like that. And any prescription, I don't have any prescription drugs at the moment, but any of them, I'll just, so it's all, I know where it is. It's somewhere safe. But this is beautiful. I think I paid like $5 for it, but it's so pretty. And it just sits beside my bed, and I can keep it separate from the ones that I take every day. We're getting near the end. Oh. Planner. I never realized that when this whole journey started, I would be having so many appointments, mostly in person, some on the phone, one Zoom. I finally got to use Zoom. Like this is, I just show it very quickly, but this is 1 month worth of appointments. Mostly because I'm nearing the end of the treatments, and these are the after steps, like the scans and consultations about radiation and so on and so forth. But a decent planner. This one is from last year, but I haven't got this year's yet. This is a 2-year planner. I suppose, no, well, I'm gonna, whatever, do something with it. And notes. I mean, yes, it's the planner, but it's notes. And, oh, I'm telling you, brain fog. They do call it chemo brain. Excuse me. You can be literally, you can be mid-sentence and forget what you're going to say. You can stand in front of the refrigerator and not know what it's called. I have forgotten Opal's name. Opal has been in my life for 13 amazing years, and I've looked at her and gone, come here, cat. It's the weirdest thing, but, you know, it happens. So if you're thinking of, if you're sitting there and thinking, gee, I better go to the store and get oranges and Kleenex and whatever, write it down as soon as you think of it. Because there is always the possibility that 5 minutes later it will be gone. And as long as, that's another, you know, get a nice bright one that you can see. I've got a couple of them in different rooms in my apartment, so that if I'm in the kitchen and I think of something, I can write it down without, because honestly, there are times when by the time I get to the living room and it's not a big walk, believe me, to get to the one in my, I've forgotten, so. Dollar store, you can pick them up $4 or $5 in a package for $2. Oh, pardon me. Have them around with a pen clip to them and write it down immediately, because brain fog is a very common side effect of almost all chemotherapy drugs. So you don't want to be forgetting something important, like your baby kitty's name. I wouldn't write that down. It might come to it. Yeah, so those are like the physical things that I can show you. You taste changes. I know I did mention this a couple of times, but this is a concentrated video. Um, your ability to taste things the same way that they used to changes. I used to love water. I mean, I could drink water all day long. Um, Now I can't stand it because it just tastes like metal. So I use, like I said, I've got the electrolytes, has a bit of taste. I use, this one is great. This is Walmart one. This is black cherry one is from Food Basics. They're $3 or less. I don't even use, like it says, like, you know, one big squirt. I use a teeny tiny squirt. I just need a little bit of flavor. I don't like the heavy sweetness. But it just helps make the water go down. And you have to drink water. You have to stay hydrated. So I have gone from enjoying a lot of different foods, as you can see, to basically only being able to eat the orange slices in the little cups, mandarin orange slices, pancakes, dal, boiled lentils, rice, a little bit of chicken now and then, anything else much more than that, and I just feel really crappy, and it tastes crappy, and it feels crappy. So I just live on oranges and pancakes, which is, you know, whatever. I take my vitamins, it gets in there, and I don't barf. But even I was able to eat like toast and that, and then after a couple of weeks, the toast went too, bread went too. I couldn't eat it. Pancakes are fine, a slice of bread, no. But, you know, they tell you on your days just before chemo and just after chemo, don't eat anything that you love, because there's a very good chance that you'll lose the taste for it. So give yourself, you know, if you're like absolutely love spaghetti, don't eat spaghetti for a couple of days before and a couple of days after. Wait till like a week after and then try just a little wee bit, because it's the weirdest thing, and I don't know the science behind it, but it's very common that people will lose their taste or change their taste. Appetite's a big one too. I spend a lot of time feeling queasy, but thankfully not throwing up. And just really, I mean, if it's really bad, I'll take a Gravol. It's not usually that bad. Opal, I need to put my legs up. See, I remembered your name. Oh, she cares. As long as I call her baby, she's fine. And pretty girl, right? And sweetie pie. And fuzzy. What was I saying? Oh, gosh. That's not brain fog. That's just me. Yeah, things change. Everything changes. I sleep constantly. I'm always tired. Pretty much everybody who goes through chemo is always tired. You know, it's one of those things that drains you. It makes you frustrated, because you used to be able to get up and go to the bathroom no problem, and now you get up and everything hurts, and you're tired, and walking is hard, and this is getting into the real TMI part, but it unfortunately is another very common thing. You lose a little bit of bladder control. So I have a protection, you know, the bladder protection pads. I have one of them that I keep beside the bed, and if I have to get up at night and run, I will just carry that with me in case I need it. It's a fairly common side effect for a few days after treatment. Thank goodness, but it happens. I'm trying to think of the other really common ones. Aches, mild, not even hard, not even bad enough to like take Advil for, but constantly there. Just annoying. Just annoying. Right now, I'm at the worst point of my, like these next few days are going to be the worst. But again, they got the doses better, and it's not as bad as it was by any means. You lose interest. I love crocheting. I've got a beautiful new grandson to crochet for. I look at my stuff and it's just, I'm too tired. I'm too this. My wrists hurt. I did get some copper wristbands from Temu. And they're like $4 for a pair. And they do help. I actually just ordered gloves because they help more. The same, exact same brand, Temu brand. But a little bit more coverage because I'm going to be going to see that baby soon. And I need to get that blanket finished. I did mention the chemo leaving your body. Do not expose your, if you've just had chemo, your doctors will tell you, what's a safer period. Don't go around vulnerable people. When I go down to my friend down the hall because he's elderly and ill, I do mask, I wear gloves. I don't want any of this drug getting, because it does affect other people. They can get side effects too. So mild, like so mild, and it's really not easily done, but I'm not taking chances. I'm probably repeating myself a lot, and I apologize for that, but yeah, that's what happens. What are we at here? Oh, half an hour I've been rambling. Okay, yeah, I talked about things that they give you nice warm flannelette sheets when you first get the drip in, and it's cozy, but they cool off really quick. I have a blanket that I take with me from Temu. I had bought this one to take. This is the blue willow pattern, but it's too big. It drags on the floor. That's why it's covering my chair. But I got it just a nice little one that covers my shoulders and chest, and that's usually enough. But basically, it's get whatever makes you comfortable, that's safe. If you hear that mushroom coffee or all of these things help, that's fine. But ask your doctor first. Don't just go popping stuff. I mean, that's common with, a lot of things. You just don't. You make sure that what you're doing is good for you, healthy for you, and safe. I think I was, mask up, glove up if you're going to be around susceptible people. This is why I haven't been able to see my grandson. I did just have the chemo when he was born. He came 2 days after my treatment, on the 17th. So I had to wait. To be safe, I wanted to wait 2 weeks before going to see him. And then I caught a cold. So I had to put that plan aside too. Now I just had the treatment, so we're going to try and aim to go again in about 2 weeks. And I'm taking really good care to make sure that I don't get another cold or get rid of, this one is finally truly gone, but I will still mask up and glove up and that. Maybe not the gloves and that, but wash up real good. I cannot wait to see him. Hold him. We waited a long time. They've waited a long time for this beautiful little boy. But I've been so excited. Makes this whole journey a lot easier. That's the final thing, I think. It's not an easy trip, and for some it's so much harder to get through. For some it's easier. I mean, I see people that are going into the clinics when I'm in there, and they go in and they look good, and they act like they're feeling good, and they're in there for half an hour, and they're out and they go to work, and that is so amazing. There are some people that actually, have to be wheeled in. They come in on a stretcher. They're really, really suffering. And then there's everything in the middle. And I fall in the middle, closer to the good end. So thank you. But I've had so many people praying for me and for my friends. And for a little while I thought Opal had gotten in contact with chemo drugs because I was petting her too soon. She got sick. I think it turned out to be just like an anxiety thing. Um, and she's fine now. And I'm still loving and masking in that when she wants to cuddle. So, but because it goes everywhere. It goes everywhere. So you have to be careful. And this is not a scare video. I really hope you don't think that this is a scare video. I really wanted this to be just a helping video. And, you know, suggestions, things that have helped me. And they might help you, they might not. I really hope they do, especially the ones that cost money. But yeah, I'm going to, I think, make a list, like a written list, type list, because my handwriting is awful. And I'll put it in the description below soon. I don't know, can you add them after? You can edit, right, and add a description after. In case you're interested, know anybody that might be interested, just the names of these things, and so you don't have to watch the whole video again. But you can if you like, because you know, the more views, the better, right? I guess. If you are going through this journey, more power to you, strength to you, prayers and positive thoughts for you. For everybody. It's not easy on the people around you either. They want to help, they don't know how. Some people just pull away. They don't want to deal with it. That's, you know, if you have a hard time dealing with my bald head and my masking and, you know, my occasional complaining about the aches and stuff like that, if you can't handle that, then that's, if it's going to affect you, don't let it affect you. Just wait till things are better. You know, I'm okay. I haven't had anybody do that anyway, so. Yeah, there's a lot of things to deal with, and there's a lot of supports. Now I'm in Canada, so it's, you know, the Canadian Cancer Society. There's Wellspring. There's a lot of supports out there. Community care. You know, you can look into that for all kinds of stuff. Transportation, food banks that will deliver. You name it, you can find the resources for it. It takes a little bit of digging. So yeah, I think that oh, no, there was one other thing that I kind of forgot about because mine's gone now, the PICC lines. It is just a very, very thin plastic tube that goes in through a small incision in your arm, goes up through your shoulder, down into your chest, to a artery by your heart, and that makes the IV for the chemo drugs so much easier than trying to find a vein and all of that. So I had the PICC line, but you cannot get it wet. You have to have the changings dressed every week. I was very fortunate. I had a nurse that was able to come to me to do the dressing change. But for showering and stuff like that, you have to keep it covered. You have to keep it absolutely dry. So I got these. I think Opal might be sitting on them. Are you sitting on them? Nope, you're not. They're little plastic sleeves. And I know I brought some out, but they might have fallen. Yes, I know. But yeah, no, just little plastic sleeves. You pull them up, pull it up over it, tape it down with some good waterproof tape, and then go ahead and shower. But you still have to keep your arm out and not let that get wet. They have, now I've got big arms, so I had a bit of difficulty finding sleeves on Temu or anywhere. But the ones that I did end up getting were fine. They were, again, like 50 pairs of them for $3 or $4. They're just clear, disposable. You can also buy them that are reusable, but those didn't fit me at all. So they were, you know, that was my bad. So I'm going to, what am I going to do? I don't know what I'm going to do. Oh yeah, keep Kleenex on you at all time. Like this little pouch of Kleenex. There's like pack of 10 of them for $1.50 at Dollarama. Um, Chemo takes away your hair everywhere. And I know I mentioned this in the last video, but this is again what I said, concentrated video. Hair, 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 underarm hair, leg hair, everywhere hair, gone. Now here and here, I didn't mind it at all. The legs didn't mind, the underarms didn't care. Just like one less thing to shave, right? This, whatever. I knew it was going to happen, so it's not detrimental. But the nose hair, constantly have a runny nose. Constantly. So, you can go, but that's not nice. So, Kleenex. I do believe that that's pretty much all the stuff that works for me. Yeah, I'm just looking around. I got the hand sanitizer, got the cookies. They give you cookies when you have chemo. Cookies and juice. And you can get 2 different kinds of cookies. This very lovely lady comes around and has this thick of cookies and juices and waters and stuff. I have found, now I'm out at a hospital in Mississauga, next city over, and the nurses at that hospital are, and I'm sure at other, I've only met them there, but oncology nurses are a special breed. They are amazingly kind, patient. A lot of nurses are. I'm not all. I would tell you a story one day, but I might get myself in trouble. It involves a family member. But no, I'm out at the hospital in Mississauga, and they are wonderful. And it makes it easier to get through. So, and again, like I keep saying, making it easier is what it's all about. It's a crappy thing to have to go through, but there's a lot of stuff out there that help. And I know I'm repeating myself, and I'm dragging on, but this felt important to me because I have always been a helper, and I'm not bragging, but I've always been a helper. I've always wanted to make sure that things are good for people, do whatever I can. And I'm watching some of these people come, and some of them are kids. They're like in their late teens and 20s, and it's heartbreaking going through all of this. But if, we get chatting and they say like, oh, it's like I get itchy so bad, I just pull out my Bactine and say, try this, try this, try this. I always carried little barf bags in my purse because sometimes I feel sick, but I don't get sick, but one of these days I might, so I've got a whole bunch of these little blue barf bags. And the last time, not this one that just passed, but the time before, there was a girl who was feeling really queasy, and she was on her way home, and she asked if they could, if they had any like little barf bags that she could take, and they gave her, it looks like half of a cowboy hat. It's really funny, but it's not secure, like spill, but these little bags are, you put them up, and I had a brand new pack in my purse, like I buy them in packs of 3, so I just tossed it over to her. Like, here you go. I've got many, many, many of them, so I can do that. I love Temu for stuff like that. I was really shocked at how many supplies that they had that were beneficial to me. So take a look on Temu or Amazon or Wish or wherever you like to shop. Chances are pretty good you'll get something if you need cheaper. I really do look like Uncle Fester. Anyway, I'm embracing it. I'm embracing it so much that I got, oh, did I not bring it over? I didn't. I got a new wig, but I forgot to bring it out. Oh well. It's just a headband with hair at the back. And then I've got another headband that I put in the front because the headband is not, anyway, I'll wear it next video. I'm glad you hung around. I'm glad if you did watch this, I'm really glad you did. I really do hope that it helps you or helps a friend or family member that is going through something like this. It's all about making it easy. It's all about comfort and getting through. And yeah, I've scattered and rambled, and I apologize for that. But I did it, and I'm glad I did. I don't want anybody to have to go through anything that they don't have to go through. And I had people, like, I mean, all of this stuff, people told me about. You know, look here for this, try this for that. So everything that I've showed you, well, minus the chemo caps, because those I went looking for myself anyway, but everything that I've showed you has been told to me by somebody else going through it. So just passing it on. Enough talking now. You get lonely days too, you know, where you just come on and make videos so that you can chat with friends. Okay, I'll see you later, friend. Bye-bye.